Good morning, and thank you for joining our weekly COVID-19 briefing. As always, we're joined by Health Commissioner Dr. Cheryl Bedegal. Today's briefing is for press only, but as usual, we're live streaming on the Health Department's YouTube channel. Members of the public are encouraged to check the Health Department social media accounts for the link to the briefing. Today's briefing will run until 11 a.m. As usual, we will present remarks first in English, then in Spanish. Then I'll open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions and that we limit questions to 3 or fewer. Please keep your questions focused on the topic of the COVID pandemic and the city's response to it. With that out of the way, Dr. Bedegal, would you please start us off?
Good morning, everyone, and welcome back to our weekly COVID briefing. When we talked last week, I had hoped that we might be past the peak of the Omicron wave. The data from the past week does continue to show real improvement, but I have to stress COVID is not over, no matter how much you or I want it to be. As of yesterday, we're seeing an average of 996 new cases per day, which is compared to 2,000 cases per day last week. Our worst day was January 12th, when we saw 3,570 new cases per day. That means that cases are down nearly 75% since then. And the percentage of tests that are coming back positive is now down to 12%. It is still too high, but far below our worst day on January 4th, when nearly 40% of tests were positive. The number of people who have tested positive for COVID in hospitals in Philadelphia was 912 yesterday. Again, still far too high, but about 30% lower than last week. All of these are good signs and make me feel hopeful. But as I've said in the past, what happens next depends on us. Masks, vaccines and boosters, isolating and quarantining when sick or exposed, and avoiding indoor gatherings when possible still matter. Before we get to the vaccine numbers, I wanted to announce that we've made significant improvements to our vaccine database this week. Later today, we'll be uploading a new vaccine dashboard to the phila.gov/COVID website that includes data from the state and more information on boosters. For several weeks, our staff have been working with the State Department of Health to incorporate detailed data about doses of vaccine that Philadelphia residents have gotten in other Pennsylvania counties. We still don't have information from other states, but this is a big improvement in our understanding of who in Philadelphia has been vaccinated. The biggest changes in our database are for children and for boosters. Yesterday, we reported that 35.3% of Philadelphia children between 5 and 11 had received at least one dose of COVID vaccine. Today, the additional data from outside the city allows us to know that 44.5% of our children have received at least one dose. In addition, we've added nearly 85,000 booster doses to our database, which means that nearly 30% of Philadelphia adults have been fully vaccinated and boosted. The other big change was that the percentage of Philadelphians 12 and over who have received at least one dose of vaccine has gone down by 4 percentage points to 88.6%. This is due to our efforts to clean up and get rid of duplicate entries when we added the state's data to our own. So as it stands right now, more than 95% of adults, 88.6% of those 12 and up, and 44.5% of children 5 to 11 in Philadelphia have had at least one dose. 78.6% of adults and 72.8% of those 12 and up are fully vaccinated. This is not every vaccine that a Philadelphian has received, but it's the best we've had so far. It shows me that we still have plenty of work to do. The Omicron wave has shown us how quickly things can get bad again, so don't wait for that to happen. If you're eligible for a vaccine, please get it today. Visit phila.gov/vaccine for the nearest location. This past Sunday was Maternal Health Awareness Day, so I wanted to take a moment and thank those maternal health care providers who have worked tirelessly throughout the pandemic. They've continued to show up for pregnant and birthing people throughout the pandemic. In fact, during the pandemic, staff at Philadelphia's 5 birthing hospitals have delivered 33,476 new babies. On this day that we're looking hopefully to the future, this is one more reason to celebrate. And finally, I need to once again ask every Philadelphian who is able to give blood. With many organizations that normally hold blood drives on hold because of the pandemic, our hospitals are facing a critical shortage of blood. Donating blood is simple, it takes little time, and it can save a life. At a time when we're all painfully aware of how much we rely on each other for safety, this is one very tangible thing that we can do to help our neighbors. To close, as always, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. And now I'll turn it over to Zelly to present these remarks in Spanish.
Good morning. Buenos días y bienvenidos de nuevo a nuestra sesión informativa semanal sobre COVID. Cuando hablamos de la semana pasada, tenía la esperanza que podríamos haber superado el pico de la ola de Omicron. Los datos de la semana pasada continúan mostrando una mejora real, pero tengo que recalcar, COVID no ha terminado. No importa cuánto tú o yo queramos que sea. Hasta ayer, estamos viendo un promedio de 996 nuevos casos por día en comparación con los 2,000 casos por día de la semana pasada. Nuestro peor día fue el 12 de enero, cuando vimos 3,570 casos nuevos por día. Eso significa que los casos han bajado casi un 75% desde entonces. Y el porcentaje de pruebas que están dando positivo ahora se ha reducido al 12%, que sigue siendo demasiado alto, pero por debajo de nuestro peor día, el 4 de enero, cuando casi el 40% de las pruebas fueron positivas. El número de personas que han dado positivo por COVID en los hospitales fue de 912 ayer, todavía demasiado alto, pero 30% más bajo que la semana pasada. Todas estas son buenas señales y me hacen sentir esperanza. Pero, como he dicho en el pasado, lo que suceda a continuación depende de nosotros. Las máscaras, vacunas y refuerzos, aislar y ponerse en cuarentena cuando están enfermos o expuestos, y evitar las reuniones en interiores cuando sea posible, siguen siendo importantes. Antes de ayer, a los números de vacunas, quería anunciar que hemos realizado mejoras significativas en nuestra base de datos de vacunas esta semana. Más tarde hoy,
No, that's been superpower. I'm telling you, I know it. I also believe that you both should.
Sorry about that. Más tarde hoy subiremos un nuevo panel de vacunas al sitio web de phila.gov/COVID, que incluye datos del estado y más información sobre los refuerzos. Durante varias semanas, nuestro personal ha estado trabajando con el Departamento de Salud del Estado para incorporar datos detallados sobre las dosis de vacuna que los residentes de Filadelfia han recibido en otros condados de Pensilvania. Todavía no tenemos información de otros estados, pero esta es una gran mejora en nuestra comprensión de quién en Filadelfia ha sido vacunado. Los mayores cambios en nuestra base de datos son para niños y refuerzos. Ayer informamos que el 35.3% de los niños de Filadelfia entre 5 y 11 años habían recibido al menos una dosis de la vacuna COVID. Hoy en día, los datos adicionales de fuera de la ciudad nos permiten saber que el 44.5% de nuestros niños han recibido al menos una dosis. Además, hemos agregado casi 85,000 dosis de refuerzo a nuestra base de datos, lo que significa que casi el 30% de los adultos de Filadelfia han sido completamente vacunados y aumentando. El otro gran cambio que fue el porcentaje de residentes de Filadelfia de 12 años o más que han recibido al menos una dosis de vacuna se ha reducido en 4 puntos porcentuales a 88.6%. Esto se debe a nuestros esfuerzos para limpiar y deshacernos de las entradas duplicadas cuando agregamos los datos del estado a los nuestros. Entonces, tal como está en este momento, más del 95% de los adultos, el 88.6% de los mayores de 12 años y el 44.5% de los niños de 5 a 11 años en Filadelfia han recibido al menos una dosis. El 78.6% de los adultos y el 72.8% de los mayores de 12 años están completamente vacunados. Esa es la vacuna que un filadelfiano ha recibido, pero es la mejor que hemos tenido hasta ahora. Me muestra que todavía tenemos mucho trabajo que hacer. La ola de Omicron nos ha demostrado lo rápido que las cosas pueden volver a ponerse mal. Así que no esperes a que eso suceda. Si eres elegible para una vacuna, consíguela hoy. Visite a phila.gov/vaccine para conocer la ubicación más cercana. El domingo pasado fue el día de concientización sobre la salud materna. Así, quiero tomar un momento y agradecer a todos los proveedores de atención de la salud materna que han trabajado incansablemente durante la pandemia. Han seguido apreciando para las personas embarazadas y en el parto durante la pandemia. De hecho, la pandemia, el personal de los 5 hospitales de parto de Filadelfia ha dado a luz a 33,476 nuevos bebés. En este día queremos que con esperanza hacia el futuro, esta es una razón más para celebrar. Y finalmente, una vez más, pedirle a cada filadelfiano que sea capaz de donar sangre, que lo haga. Con muchas organizaciones que normalmente suspenden las campañas de donación de sangre debido a la pandemia, nuestros hospitales se enfrentan a una gran escasez crítica de sangre. Donar sangre es simple, lleva poco tiempo y puede salvar una vida. En un momento en que todos somos dolorosamente conscientes de que cuando dependemos unos de otros para la seguridad, esta es una cosa muy tangible que podemos hacer para ayudar a nuestros vecinos. Para cerrar, como siempre, si desea más información sobre la pandemia y la respuesta de la ciudad, puede visitar a nuestro sitio web phila.gov/COVID. Si tiene algunas preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Thank you. Gracias.
Thank you very much, Zelly. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function, and we'll take those questions in the order received. As noted earlier, we ask that media outlets coordinate internally and keep their questions focused on today's topic. If there are any reporters who do not get the opportunity to ask a question or have questions about other topics, please follow up with us by email and we'll get you an answer. First up, we'll go to Mike D'Onofrio from Axios Philly. Go ahead, Mike.
Hey, thanks. Just a couple questions here. So maybe big picture, are the dropping case numbers a signal that this current COVID wave, Omicron, has peaked in Philadelphia?
That does appear to be what's happening. The thing to be wary of is that Omicron is still, it's 98% of what we're seeing in Philadelphia. It's highly contagious. So our ability to maintain this dropping case count depends on what people do.
All right. And in terms of the dashboard, why put this thing together? Why do this? Why launch this new dashboard?
So we've had challenges, which I think we've talked about a number of times before, with the fact that there is no national data set. So we have our Philadelphia data. Philadelphia maintains its own immunization registry. We know that some Philadelphians got vaccinated outside of the city limits. So we were able to get the data from the state. We've also shared Philadelphia data with the state for people vaccinated in Philadelphia who are from the surrounding counties. We were able to get that data, and we wanted to be able to include that data because what you have previously seen on our data dashboard, for example, demographic data didn't include the data from outside the state. We had very limited just aggregate numbers. So it gives us a more accurate picture of where we really are right now, which helps inform our vaccination efforts.
Unmute. All right, thanks. And then maybe just lastly, what's the biggest difference between the old and the new dashboard in terms of like looks? Is it going to look completely different? Is it going to be more intuitive? Can you tell me a little more about it?
The design will be very similar. I guess the newest piece in the design is having a breakdown of the boosters, which is something I personally had wanted to see, and I'm sure other people did too. And who's getting boosted? Is it the people at most risk? Where are we not reaching people with boosters, which is always the most important operational question. So that section of the dashboard is new.
All right, thank you very much, Mike. Next up, we're going to go to Jason Laughlin from the Inquirer. Go ahead, Jason.
Hi, thanks for coming to me. Did this data dump that you received, did this give you a little more detail on who's received boosters? I know last week you said about a third of boosters have gone to people 65 and older. Do you know if that number is still accurate? And has this changed your understanding of the demographics of who's gotten shots and who hasn't?
So that number is consistent with what we'll see on the dashboard. It's going to, I hope, go live this afternoon, I believe. So about a third of people 65 and over have gotten their booster. It just gives us a fuller picture.
Mm-hmm.
Before we just had the raw number, this many people have been boosted. That's not a lot to go on in terms of who do we still need to reach.
Yeah. Looking, and obviously the math is going to change when that dashboard is fully updated, but based on the numbers you gave us a few minutes ago, it does seem like the city's, even with that additional data, the city's booster rate is still pretty low. I think off the top of a calculation looked like about 33% of vaccinated people got boosters, which is lower than statewide. Do you have any further thoughts on why that number is kind of lower than the surrounding counties or the state?
We've done a lot of really grassroots, granular work in collaboration with community groups to get people vaccinated who didn't necessarily, step forward eagerly and say, I'm desperate to get this vaccine. And I think it's been a little bit challenging. One of the challenges people describe is being worried about side effects, for example. Convincing people that they need that additional dose is a little bit of a heavy lift for people who weren't that convinced that they wanted to get vaccinated in the first place. But that work is ongoing, and the rates are going up steadily. So I think we'll get there. It's just a matter of directing our efforts using this additional data.
Okay, I think that's all I had. Thank you, Doctor.
Thank you very much, Jason. Next up, we're going to go to Rudy Chinchilla from Channel 10. Go ahead, Rudy.
Thank you. Dr. Bedigol, you mentioned earlier, one of the things you said was what happens next depends on us, right? Depends on the people. What can people expect once we start seeing more drastic, cuts of infections, fewer increases of infections? Like, what can people expect in terms of rule changes, mandates, and stuff like that, that the city currently has in place that maybe, I don't know, we're thinking about removing or cutting back on if we can start getting the case counts down again?
So we would love to do that. We're starting conversations now about what does an off-ramp look like. And we still have nearly 1,000 cases a day. So if you look at, for example, the CDC's color-coded, what's high, moderate, low transmission, I think they have substantial in there as well. We're still very far into the high transmission range. And if you remember back last summer, we went as low as below 50 cases a day. Close to 1,000 is a lot. Positivity over 10% still means we're missing a lot of the cases. So there's actually well over 1,000 cases per day, could be several thousand realistically. So we're not at a place where we're ready to roll anything back yet. Omicron is still very, very actively in circulation in the city. And as we were just saying, many people remain unboosted. But starting to think about what, at what case counts would we do that? It's going to take us a while to get there. And when I say it depends on us, we kind of know at this point what the choices that we make should be. It's a matter of people being willing to stick with that this far into the pandemic and kind of apportioning the risk, not going to big parties, maybe, getting together outside when they can, getting together with fewer people, keeping their masks on. But Omicron is the same as it was a few weeks ago when it shot into the thousands and our hospitals were full to the gills. So, it's the same virus. It can recur in that same way if we're not careful.
And my second question is sort of related to that. Part of the reason I asked that first question is because I'm hearing a lot of people sort of getting frustrated. People who are vaccinated and masking and doing all they're supposed to do, they're sort of getting just exhausted with the regulations, with showing their vaccine card, stuff like that. So what is your message to them? What is your message to the people who have been doing everything right, but are just so exhausted now, a couple of years into the pandemic, that we're still having these restrictions?
I mean, first, I think people are right to be frustrated. I am personally also really frustrated that we are still facing this, that we, are facing, unfortunately, a variant of the virus that doesn't necessarily act like earlier versions, where doing everything right doesn't necessarily mean that you can't get and transmit COVID. So, the vaccine prevents serious complications, and that's clear. So people who are fully vaccinated and boosted have really good protection against ending up in the hospital or dying. They could still catch COVID. They could still potentially transmit COVID. And that isn't fair, right? We've done everything right. It isn't fair. But that's kind of where we are. And I think being realistic about where we are is important. And then deciding for yourself, this doesn't mean sit home all the time, never see anybody. It means manage your risk, fewer people, masking more, being outside more, doing things that are safer, at least, so that we as a city don't skyrocket the way we did.
Thank you, Dr. Bedko.
Thank you very much, Rudy. Jason, I'm going to go to Ayana real quick, since she hasn't had a chance to ask questions, then we'll get back to you.
Okay.
Go ahead, Ayana Jones from the Philly Tribune.
Hi, yes, good morning. Thanks for taking my question. I appreciate that. Dr. Bedko, do you have any information as to when and where will local residents be able to get access to the masks that are coming down from the federal government?
So my understanding is that the masks are going to be available in local pharmacy chains. I don't have an exact date yet, but it sounds like very soon. They will be available in some community health centers, but so far, at least, that's been extremely limited in terms of what they're projecting for the rest of January. So I think the pharmacy chains are going to be our best bet. It sounds like all of the local pharmacy chains will be carrying them. They'll be up to 3 per person. And, I would just look at the pharmacy chain websites or, stop by your local pharmacy to find out details on when exactly they'll have them available, but I haven't seen a date yet.
Okay. And then also, thank you for that. And then also as a follow-up to you all releasing guidance for the schools last week, are you getting any feedback from the schools in terms of how they're able to respond to this guidance that you all issued?
Yes, so we've been in close conversation with the school district, and the local schools are staying with the 10 days of isolation and quarantine for now, at least. As they have throughout, kind of doing their best to manage what is just a very tough situation in terms of people whose primary mission is education rather than public health. But we're working closely with them.
Okay, thank you. I appreciate that.
Thank you so much, Ayana. Jason, we will head back over to you to close this out. Jason Laughlin from the Inquirer.
Hi, thanks. Sorry, a couple other things. Two testing questions. One is there. I think you had said a few weeks ago that the city was planning on distributing more free tests for people. I wanted to check on the timeline for that happening, or if it's happening now. And the second question, I'll ask them both at once. Have you gotten any reports of price gouging on tests in the city? People who think they're paying above the rate they should be paying for those COVID tests?
So on the additional shipments of free tests, we're still waiting. There are lots of supply chain problems right now. I think the big federal buy is taking a lot of the supply. So I would really encourage people who haven't yet signed up for their free federal tests to do that, so you have some at home. That is the covidtests.gov address, or you can call 215-685-5488, and our folks will help you to sign up. Very easy sign up though, and you get 4 free test kits. But we do hope to have more soon. With supply chain problems, I'm just not sure exactly when. Price gouging, there's been price gouging on everything else in this pandemic, so it wouldn't surprise me, but I have not heard specific reports.
Okay, thanks. And real quick, how many tests are you waiting on to get delivered?
We can get you the exact number, but I don't have that right now.
Okay, thank you. That's all.
Thank you very much, Jason. We have one last question from Carla Robinson from Chestnut Hill Local. Go ahead, Carla. You can unmute right now. You can try it.
Thank you.
There you go.
I was wondering if you have any idea, when I look at the last time I looked at the map, it seemed to me that Northwest Philadelphia, which is the area that we cover, of course, seems to be faring a little better than the rest of the city. And I wonder if you have any thoughts as to why that might be.
Well, in general, COVID has tracked with poverty and vaccination rates have tracked with affluence, and Northwest Philadelphia, tends to be more affluent. So, it just has more resources. So it's not surprising that Northwest Philly has done better. The final map on the updated dashboard will probably reflect that even more once, I think that probably a lot of Chestnut Hill residents may have crossed the border to get their vaccines. So we may not have picked that up in just our local data. So, if you take a look at the map, you may see that this afternoon.
But how would that track with Center City, Rittenhouse Square area, which is also very affluent?
Right, and Center City overall has also done well.
Okay. Okay, thank you.
I have a note in the chat here from Mike D'Onofrio from Axios. Mike, do you have one more question for us?
No, that was from earlier. But you know what? Yeah, how about might as well ask this new dashboard. Did you guys make it in-house, or did you seek a third-party vendor?
No, this is in-house. We have
Okay.
an amazing team of EPI folks who have been working hard on this.
All right, cool. That's all I got. Thanks.
Excellent. Thank you very much. And with that, we are out of time. So I want to thank everybody for joining us today. As a reminder, this briefing is usually held weekly on Wednesday mornings. Details on next week's briefing will be issued via media advisory. Thank you all very much and stay safe.